it's one of these very serious infections that absolutely comes on very quickly, can present non-specifically like a flu-like syndrome.
Dr. Vega, could you explain to us a little bit what exactly is meningitis and how can it make a healthy teenager seriously sick? And how can it happen so quickly?
Right. Yeah. So I just want to also voice Patty, my condolences on everything that's happened, and just really appreciate your strength and your power and in getting through that. And now, being an advocate so we can affect change to reduce the impact of really what is absolutely, you're right. It's a terrible disease with a mortality rate of 10 to 15%. And that's with treatment. So it's very serious. What it boils down to is inflammation of the meninges, which is the lining of your brain and your spinal cord. Unfortunately, it's a very rich area for either a virus or a bacteria to grow. And it doesn't, it's also fairly protected from your immune system. There's a blood-brain barrier. And so once you are infected with meningitis, the risk of mortality, the risk of disability, even if you are fortunate enough to survive bacterial meningitis, it's fairly high. And so it's one of these very serious infections that absolutely comes on very quickly, can present non-specifically like a flu-like syndrome. But very importantly, the reason I think we're all here is because we can prevent it. We have driven down the rates of bacterial meningitis substantially thanks to the use of the meningococcal vaccine. And so we just have to, keep moving that ball forward and protect more kids like Kimberly.
Dr. Vega, before we get into talking about the vaccine itself, could you give us a quick bullet list of warning signs that parents should look out for that might mean their child has meningitis, and how quickly do these symptoms escalate?
Right. So it is challenging at first. And so, even as a clinician, I wouldn't necessarily, beat myself up for someone, who comes in like, well, they're feeling a little down and they have, some mild fever and some runny nose. We're going to think that's a viral infection because 98% of the time we are going to be absolutely correct in that. And so we don't want to, necessarily overreact. But watch if it's whether it's a child or an older adult, watch them closely. And if you notice the fever is going higher, if they're developing severe headaches, if they start having symptoms like vision changes or they're getting confused, they're having a lot of back pain, neck pain. It's really hard to move their neck. It's getting stiff. Try to think about these things and be proactive. Get them into a clinic sooner rather than later, because really at that point, every hour certainly counts.
It sounds like parent instinct. I know when my daughter was sick, she was very small and it was just something was off and that fever. And I called thinking it was just a cold. And they said, oh, no, get right to the emergency room. And I think to Patty's point, like you just know as a parent, something's wrong and maybe to, trust your gut and get health care to your kid quickly rather than wait.
Right. Yeah, you are the expert in your child. So yeah, absolutely. I respect that quite a lot.
Yeah.
When the doctor in the emergency room told me that, she suspected Kimberly had meningitis B, I said, oh my God, what if I had brought her to the emergency room last night when she had body aches and a fever? She said, we would have sent her home. Mm-hmm. We wouldn't have suspected meningitis at that time because it does have vague symptoms at the onset.
And the only reason we were sent to the emergency room was because she was so little. It was within the first month of life. So that was a fever of unknown origin. So that was the only reason that it was taken a little bit more seriously. But you're right. And a little older, she would have just been, same thing.